pleasure of seeing one of my patients. She's 6 years out from a lower body lift, and you can see her scar. We pulled this up so you guys can actually see the scars 6 years out and the degree of correction that has lasted. And you can see how beautiful her high definition tummy tuck has held up. And as we rotate her, you see the outer thighs are still nice and firm. She has a beautiful buttocks that again has not sagged, 6 years out. And this is her incision on this side. And now I'm gonna show you the incision on the other side. So perfectly placed at the junction between the lower back and the upper buttocks, not in middle of the buttocks where you can see some other people are doing, and I completely disagree, because if the incision is too low on your buttocks, then your buttock looks misshapen. On the back of the thighs, outer thighs, and so forth. And then we did a vertical thighplasty, and this is the incision for that. So today I'm seeing one of our patients. She's flown back for a follow-up after a lower body lift that was done about 3 months ago that included a tummy tuck revision, pubic lift, anterior thigh and outer thigh lift, and buttock reshaping, lower back skin excision, and a buttock lift. And she's healing perfectly and looking amazing. Just look at her incisions. In the back, we did a buttock lift and buttock reshaping and fat transfer to the buttocks. And you can see how fabulous she looks. What do you think?
I love it.
So, a follow-up on one of our patients. 3 weeks ago, I did a huge surgery on her. Total revision of virtually everything you see, and including her thighs, including her lower body lift, including her vertical fleur-de-lis incision that I don't put on my patient. So we revised everything. We liposuctioned her, we sculpted her, we did a comprehensive lower body transformation. She's 5 weeks from her wedding. So 3 weeks from surgery, 5 weeks time she's having her wedding. Tell me, what do you think?
I am in awe. I mean, I feel like I'm shocked. I didn't, think it could ever be me. Oh, sorry, I'm gonna cry because surgery makes you emotional. I realized, no, we're good. Happy tears, they're good. I never thought that I could have the legs that I didn't wear a skirt with. I've worn a skirt for the last 20 years, since I was a teenager. So the thought of getting to do that and to feel like all my hard work has paid off, and to be able to see a muscle in the leg and not see the jiggle, and to feel like I'm not wearing a jacket of skin.
Yeah, you will be. You can see how much we've been able to achieve with one surgery. Again, this is revised. I made her belly button smaller. I made this vertically oriented, meaning that her incision was crooked. You see how perfectly it's placed. Coming to the front, she's healing. 3 weeks, so you can see what a 3-week incision looks like. Here and then here. We have one drain in place still. She's still draining a little bit. I like using drains because it gets my patients to heal faster. This is her inner thigh, vertical thigh plasty incisions. She had a ton of contour irregularities of her thighs that I corrected for her, but a lot of corrective surgeries went into her thighs, and then on her back, buttock lift, buttock enhancement, and again, let me show you scars and how perfectly she's healing and how perfectly these scars are placed. So there you go. And you won't even know that she has had this lower body lift correction. This is a redo. Thank you for healing so well. Ultimately, that's like half the surgery. So today, I have the pleasure of seeing one of my patients. She had a total body lift about 2 years ago. It was done in 2 stages. It included a lower body lift, buttock augmentation, liposuction, liposculpting, and a dermal bra breast lift. How old do you feel? How old do you feel in your body?
20.
Really?
Yes.
Again, these surgeries are for everyone. They're not just for weight loss patients. I'm calling them mommy lifts because You can do so much with them through that incision. You can completely reshape, remodel, restore, and change somebody's body and make them feel great in a bikini, which is really the goal of the surgery, or naked. I mean, you can see how beautiful her three-dimensional sculpted abdomen looks. This is not liposuction. This is our high definition tummy tuck. Keep on rotating, sweetheart. So you can see that the angle is a three-dimensional shaped tummy. You like it? Love it, right? And this is, what can I say? I mean, she looks fabulous. Coming to her backside, you see how beautiful she's healed. These are her incisions for the lower body lift and buttock enhancement. Thank you. So we are 2.5 weeks out from her lower body lift revision, spiral thigh lift revision. What do you think?
I'm in love. Literally in love with myself now.
I love it. Look how beautiful these buttocks look. And some of that has to do with the fact that we actually planned it correctly, but what you saw on the operating room table was not the final result. Meaning that, I'll give you an example. On the operating room table, she appeared to be wider here and shorter here, but I had just liposuction these areas because she had told me prior to surgery that I want to be more linear. I don't want to have hips. So to me, I'm able to follow what my patients want, and nothing I do is cookie cut procedures anymore. These are all customized to what the patient wants or what you want. So when she said, I don't want to have hips, I took the hips down. But what you see on the operating room table is swelling in that area, which makes her buttocks appear to be wider. Another thing to take in consideration is the fact that I have to work with prior surgeries and prior incisions that previous surgeons have placed on her. If she has an incision here, I cannot put another one here because the skin in between will die. You have to utilize that previous incision. So if that incision was placed here, then I would have had to use that here and then brought it up here. So fortunately, we were able to bring it high enough to create this beautiful round buttocks, which is the ideal buttock. You want to have a round buttock shape, and that's what she has. Her posterior thigh lift incision was here, and I brought it high enough. Again, this incision and this incision controls her buttock height, and the width can also be controlled by rotation. So we've controlled everything, and it turns out to be pretty magnificent in her case. And you can see as she turns, she looks beautiful. Prior to my surgery, the left buttock was slightly bigger than the right one. We tried to make it more symmetrical, but time will tell whether I need to go back and do additional fat transfer to the right one. We are somewhat limited by the amount of fat she has. I also lifted the outer thighs, the front of the thighs, the inner thighs, and did an inner thigh lift revision. The navel is from her previous surgeries, is not mine. I do not like round navels, but she's healing beautifully. This is 2.5 weeks out. And then the inner thigh incisions, any comments about those?
I'm glad just to have them. I didn't have any before.
She's talking about her labia, because they had placed these incisions lower and she had labial spreading. So in the process of redoing the lift and bringing the inner thigh skin higher, we actually recreated the fullness of her labia. Essentially what happens is that when the incision is too low here, it pulls on the labia, and essentially it alters the shape and the fullness of the labia by spreading it and making it wider and more of a flatter labia. So when you correct this, when you bring this up, when you reconstruct the groin crease, you not only are placing the inner thigh lift incision in the proper anatomical position, but also you're recreating the fullness that is part of the labia as a result of it. And that's what she's referring to. Thank you.
Thank you.
We are seeing one of our patients. She's been 9 months after lower body lift. I mean, just look at that behind. Her buttocks look amazing. We did a buttock lift and buttock augmentation with her own fat. And then I'm gonna rotate her a little bit. You see that? Very natural. Let's go to the other side. What were your buttock? What did they look like before?
They were just very kind of lumpy and saddlebags, and there was some projection, but just a lot of skin, and never had smooth buttocks like this.
And then on the front, put your arms behind you. We did a tummy tuck revision. This is her original navel from her first tummy tuck. It wasn't done by me. I did a tummy tuck scar revision and a lower body lift with thigh lift, outer thigh lift, thigh front lift, some liposuction of the thighs and buttock enhancement. And what were you telling me? And look at her, the shape of her abdomen.
And I can wear all the clothes in my closet for the first time in about 15 years, so
Really happy.
thank you, doctor.
You're welcome. So we are 5 weeks out from our lower body lift on our patient who kindly came all the way from Europe to have a lower body lift. Previously she had a tummy tuck, a midline scar here, liposuction and a Brazilian butt lift, and she just wasn't happy with the laxity of her skin and the shape of her buttocks and her abdominal contour. So 5 weeks out, and this is my incision. This is her old incision. We didn't touch this one, but we will in the future. But this is my incision, and you can see how perfectly she's healing. It's only been 5 weeks, and she's actually planning to go home tomorrow. And look at the contour of her thighs and her waist concavity. So we have a beautiful waist, and then we made her buttocks fuller and rounder. She already had fuller buttocks, but we reshaped them, meaning that we took fat from areas that she didn't like and put the fat in areas that give her the roundness and the perkiness, not only this way but this way, rather than having a larger square buttocks. She wanted specifically an hourglass look with a line flowing from her outer breast nicely over her waist, her hips coming down, and we created that because she had too much fullness here and she didn't like that. So again, listening to your patients and doing what they want specifically, and then look at her new buttocks. Also in the process, I made her buttocks narrower because again, that's what she wanted. So custom made lower body lift, correcting her abdominal contour, buttock shape, buttock size, hip contour, and thighs in one surgery. Everyone can see. There you go.